I'm Thierry Gevaert. I'm Deputy Head of Department at UZ Brussels. I'm a medical physicist and I'm also the ISRS Treasurer. I think the ISRS community is important because it brings multidisciplinary people like neurosurgeons, radiation oncologists, physicists all together. We have the same idea and the same vision about treating our patients, and I think it's important that the group is bring together in order that we can discuss, bring new thoughts and elaborate how we can manage to bring a new treatment or just elaborate how we can think more in the future how to manage to treat the patient in a different way. For me, the role of the Congress, as it's a 2-year happening, so it's biennial, I think it's important that I'm here in order that I can meet again with my colleagues. So as it's a diversity, so most of the conferences that I attend are most likely radiation oncology or physicist conferences. And here I can also finally meet with my colleague neurosurgeons that are doing a lot of radiosurgery as well. And I think it's important, it's one of the conferences where those groups are all together and where we have the same idea about radiosurgery and about treatments and about how we can bring something new together. Because at the other conferences, mostly we speak about other typical treatments, but here it's really specific also for radiosurgery. And so that makes also a strong thinking about going to that meeting because of the fact that I know that it's purely dedicated to stereotactic treatments. The highlights for me is first of all, the innovations. So we had some talks about AI. So also to look about what is the future, not only what we are doing now, but also to have a think about what's next, how can we cope with AI, because AI is getting really important into our lives also. So I think it's important also for medicine to see how to manage and how to cope with those new ideas and those new philosophies. Of course, me as a physicist, I was also going to physicist sessions, so I think also it's important to see like the new way of treatments. So like we treat a lot of multiple brain mets, so a lot of lesions, we retreat them. So to understand how to manage to retreat them in a good way without toxicity for our patients. So physics-wise was more technical, how to cope and how to manage to treat them. And then there was also a session about retreatment where we can understand what do we need to watch out in order that we can again have a safe treatment while having no toxicity for our patients. Regarding development, I think we need to think further also. Like we have a lot of brain, we know a lot of what we do in brain, but I think there are a lot of new strategies upcoming also for extracranial, and we are starting also to look into extracranial, to lung, pancreas, hepatic cancer and so on. So I think there we can move ahead as well to think further and to understand better also extracranial. I think that's a point that we need to look into, because the brain radiosurgery is important, it's the basis of our society, but in extracranial there are also new strategies upcoming, and I believe that that's also really important. And the second thing is also the combined drugs, so I think it's also getting important that we look about radiosurgery, but also in combination with new drugs or new strategies, boosting for example. And then last but not least, I think also like as we have MR technology for the treatment and so on, also looking about the dynamics, so to understand what is happening during that we are treating our lesions, and maybe also to adapt the treatment regarding to what we are seeing at the level of the tumor itself. And so I think these are the next steps that we will in the coming 2 years also have a lot of data to present at the next conference. So the ISRS certification, I think it's important when you look about any kind of department, also my department. I think when you are starting to treat your patients, you are in your own world, you know what you are doing, you have your protocols, your procedures. But I think it's also important that someone is coming to visit you, to give you advice, to see how you are treating patients and to see maybe what you can do better. It's not because we are a university hospital that we are treating a lot of patients that there is nothing that we can do better. So I think the certification is firstly to understand what can we do better and how can we cope for it on a daily practice. And then secondly, of course, also it's just to have a backup to be sure that what we are measuring as a physicist, how we treat our patients, that is safe and reliable, so that we have a double check about the dose that we are delivering to our patients, for example. So the strong point about the ISRS certification is, you have the paperwork, you have the procedures, the protocols and so on, the dose that we are delivering to the tumor, but also that there is a dosimetry audit. So we are also doing some measurements in order to see what they are treating. So we ask the center to deliver a certain dose to a phantom, and then we analyze how accurate the dose is delivered to that phantom, and then they get also a report regarding that kind of accuracy. And I think that's something really important, as we all know, if the dose is not correct, it will directly harm the patient. So that's for me really also important regarding the certification. Regarding future research opportunities, I think, like I mentioned already, I think research opportunities-wise, I think the adaptive workflows, not only in extracranial, because for the moment, like with MR-Linacs, we do a lot of adaptive in the extracranial regions, but also to look into the brain, how we can move ahead and to do a lot of adaptive treatments. So I think it's important to understand where we can do better on a daily practice, and maybe also adapt more specifically regarding the tumor and the dynamics of it, how we can move ahead to give more dose to the tumor while reducing the dose to the organs at risk.